Osteoporosis. Disclaimer: the information contained here should not be a substitute for the advice of a qualified licensed physician or other health providers. The information provided is for informational purposes only. Please check with your physician or healthcare provider with any questions or concerns. Osteo means bone, and porosis means porous. Osteoporosis is thinning of bone tissue and loss of bone density over time. Some of the signs and symptoms of osteoporosis are rounding of the shoulders, gradual loss of height, sudden back pain, and stooped posture. It is classified as the silent disease. The first sign is often a fracture of the hip, spine, or wrist. Risk factors for osteoporosis include being a woman over age 65, having low estrogen levels during menopause, and low testosterone levels in men. Women over age 65 have a 4 times higher risk of developing osteoporosis than men of the same age. Vitamin D deficiency, smoking, family history, consuming large amounts of alcohol, and a little calcium also put you at a higher risk for developing osteoporosis. If you have been diagnosed with osteoporosis, there are several ways to prevent falls. One is to use bars in showers, tubs, and near toilets, and use bilateral handrails on stairs. Try to keep night lights in bedrooms, bathrooms, and hallways. When reaching for items, bend at the knees, not the waist. Always wear flat, sturdy shoes. Use canes or walkers when necessary. Avoid using throw rugs. It is better to have even surfaces throughout the house. Make sure to keep a flashlight next to your bed and practice proper posture. Check out the posture video for more information. In order to prevent fractures, avoid smoking, being sedentary or sitting for too long, twisting and bending at the spine, walking on ice, wearing unstable shoes, and high-impact sports. Exercise is another way of preventing fractures. Try to exercise 3 to 4 times per week for 30 to 60 minutes. Include weight-bearing exercises like walking, jogging, and step aerobics. To improve strength, you can use free weights, resistance bands, or machine weights. Working on balance exercises can decrease the risk of falls and prevent fractures. See the video on balance for additional information. Tai Chi and yoga are also good preventative measures that help improve balance. You can practice balance by using unstable surfaces like a foam pad with proper supervision. Stretching, exercise classes, and cardio equipment are great exercise tools to help with prevention. With cardio equipment that may work arms and legs, try to minimize arm use. Nutrition for bone health. As many as 20 nutrients are involved in building and maintaining bone health. The critical nutrients are calcium, vitamin D, and magnesium. Calcium. Many adults need 1,000 milligrams per day. Women over 50 or men over 70 need up to 1,200 milligrams per day. Foods that contain calcium include dairy like milk, cheese, and yogurt. Fortified foods like cereals, almond milk and soy milk. Sardines or canned salmon with bones. Tofu. Dark green vegetables like collards, kale, broccoli, bok choy, and okra. And seeds like poppy, sesame, chia, and almonds. Vitamin D is needed for calcium to be absorbed by the body. Most people need around 400 to 800 international units of vitamin D per day, which you can get in about 3 ounces of salmon. If you're over 50, you need at least 800 to 1,000 international units per day. Foods that contain vitamin D include fatty fish like swordfish, salmon, sardines, and mackerel, shiitake mushrooms, some fortified foods like dairy and cereal, and egg yolks. Magnesium is found in many foods like green vegetables, seeds, nuts, and legumes. It can also be found in beans and lentils, whole grains, and avocado. What can contribute to bone loss? Alcohol and caffeine in excess can contribute to bone loss. Caffeine may make it harder for your body to absorb calcium. Sodium can cause your body to lose calcium. Check out the video on sodium for more information. The goal is 1,500 to 2,000 milligrams or less of sodium per day. Check with your healthcare provider if you feel you need a supplement to reach the recommended amounts of calcium, vitamin D, or magnesium.